Good afternoon, everyone. On behalf of Apollo Cancer Center, it's a very warm welcome. I am Kamaldeep Peter, a breast cancer survivor, welcoming you all to the first talk show on breast health. The Apollo Hospital team has put together a series of talk shows which will happen every Saturday during the month of March. So friends, March has something so special about it. There is a symphony of organized action across the globe for causes that touch women's life, give them gender parity in social, cultural, economic, political milieu. Yes, you're right. 8th March is International Women's Day. But we women cannot let International Women's Day be just a one-day concept. In fact, it is a day that brings women across the globe together and also everyone who supports the cause of women together to think, to reflect, to act and check where are we in terms of making women, inclusive in society, giving them the right place. And one important factor of women's welfare is our health. And if 50% of the population of the globe are women, you can understand how significant is her health to the family, to the country, to the community, and to the world. So, as this theme suggests, break the bias. Well, friends, there are a lot of biases in the cancer treatment management domain. And we are here today to see that we address these biases. And how do these biases, surface? It's because all the information we have about cancer many times, it's hear and say, or we are not updated with the trends of medical advancements. And then there is fear, there is anxiety, there is hopelessness, and all the advances of medical science are so badly negated. It's a pushback for the medical community after they have got ways and means of treating cancer effectively, especially in breast cancer. So our topic today is breast health, because breast health, as we get into conversation, you will see, is actually the most common kind of cancer among women. And being a woman and aging puts us at a greater risk. So we are going to break all those biases, eliminate fears, debunk those myths, dismantle wrong thoughts about breast cancer. And we are so privileged. The Apollo team has brought in a celebrity guest to us. And it's my pleasure to introduce Sangeeta Rajiv. I'm sure many of you know her, but it's always so lovely to know her a little more because her accomplishments are always on the rise. Sangeeta Rajiv is affectionately also called Sara. So welcome, Sangeeta Rajiv, to our talk show.
Thank you so much for this welcome. I'm really honored to be a part of this.
Thank you, Sangeeta, for joining us. But let me profile you, your achievements. She is a very well-known singer, not only in the Indian circuits. She's a singer, a stage performer, a composer, and internationally made her acclaim and presence by winning the Best International Pop Singer of the Year at the Vima Music Awards in 2019 in Malaysia. She is the first independent artist from Karnataka to collaborate with Sonu Nigam for a Kannada track called Neni Neni. I just heard it. Neni Neni. Yes, I heard it this afternoon and it was really beautiful.
Thank you. Thank you so much.
Yeah, and all her tracks, with the honor of pop and Bollywood, they are really being well received and featured in MTV, India TV channel, and BBC Asia Network in United Kingdom. Many awards to her credit. And, it's the International Music Awards in Canada, the Radio City, and she's, of course, a judge, even, in many of these music melodies shows where she's choosing singers, encouraging them. And with such a celebrating guest, I have a wonderful doctor, Dr. Jayanti Thumsi, who is currently the lead surgeon, breast oncology at the Apollo Hospital, Benagada in Bangalore. And I never miss telling she is my surgeon who treated me. Dr. Jayanti completed her MS in general surgery from the Grant Medical College, JJ Hospital in Mumbai. And she has undergone training in breast oncology at the Tata Memorial Center, Mumbai. She has been practicing breast oncology for more than 21 years. What an experience, doctor. And she has performed more than 3,500 breast surgeries and 2,500 other surgeries. And breast conservation and breast reconstruction are her areas of expertise. She has a keen interest in bringing awareness among women. Actually, she's trying to bridge the inequity in information across various rungs in society. She gets on into regional languages, Hindi, English, gets on for TV shows or radio talks. She's invited to, I can say, corporate offices, government offices. Her YouTube videos are available. She does Facebook Live. She's authored a very beautiful book, Lump to Laughter. And this is in its 3rd edition of publication. Very well known. And I'm so happy to say she's been honored with the Women's Achiever Award of Karnataka in 2019 by the VRL Group, the Digvijay TV and Vijayvani, and a very prestigious Kenegal Hanumantaya State Award in 2019 for her work in breast oncology. The Chanakya National Award, yet another prestigious award, where she won the Jury Special Award for Medical Inspiration by the Public Relations Council of India and the World Communicators Council in 2020. Oh, well, she is the founder of Crest Foundation. She has her name for the world's largest campaign for breast self-examination, in which 2,332 women were taught breast self-examination in a single day at a single venue. What a privilege that, doctor, you take time to increase cancer literacy, and today you will be in conversation with Sangeeta. But before that, it is said the International Women's Day comes to, also celebrate women from various domains, women who have demonstrated extraordinary resilience. And in our midst is Anuradha. She joins us and she's a cancer survivor. Today, she, of course, enjoys a retired life with a 2-month-old granddaughter, but formerly she was the principal of the government PU college and the chairperson of the 1st and 2nd PUC government of Karnataka English textbook and a state coordinator for English teachers training. Wow, what a panel! Or I can say, what what, women leaders, amazing for taking this talk ahead, and let's discuss about breast health. Over to you, Sangeeta and Dr. Jayanti.
Thank you so much, Kamal ma'am. You were talking so much about Dr. Jayanti. I feel I should call her the real life star. She is the real life star who's been working from so many years, selflessly. So hats off to you, Dr. Jayanti, for whatever you've contributed to humanity.
Thank you so much, all of you. And none of this could have been possible alone. It's a complete teamwork. Backing me is a complete team of doctors and the hospital that we work, because we need so many equipments to treat one patient. And thanks to all the patients for putting their trust into us. That's so important. And let's start.
I'd like to take the first question. So there is I was just going through the statistics on Google, and I found out that India has a lot more breast cancer patients than any other Western countries. And there is slightly a rise in it too these days. Not sure what is it, what is the reason behind it? Is it because of the lifestyle, or what is it? What do you want to talk about it, doctor? What do you have to say about this?
Right. So first of all, to all the viewers here, we've used this word cancer so many times in past 5 minutes. And I'm sure this word is extremely scary,
Yeah, it is.
Yes, it is.
When I had to say that, it was scary to me.
Absolutely. Absolutely. It is very, very scary. But let me assure you, today, we are not here to scare you. We are not here to tell you how bad the disease is. That's not the point at all. We are here to celebrate Women's Day. We are here to celebrate all of our lives. And one of the most important key points of celebration of life, I think, is looking after our health, And at this point of time, I really believe that knowledge is power. And it's our motto that we all are empowered by the knowledge. And that is the motto of these talk shows that we have planned, that we empower women with what is the fact. We need to know the reality of it. We all have heard about breast cancer. We know a little, and the half-baked knowledge is sometimes more scary. To get the reality is what is the idea. Right. So rightly, like Sangeeta said, yes, the incidence of breast cancer is on rise. Now, what do I mean by incidence? Incidence means the number of cases of breast cancer are on rise all over the world, also in India. All right. But the way the breast cancer behaves in our country and in the Western countries is quite different. In fact, by what Sangeeta said, I would like to say something else, is that the number of cases in the West are much, much more than what we see in our country. That means breast cancer is more common in the Western countries than in our country as of now. Of course, we are going to catch them up very soon. But unfortunately, what we really need to bring to our notice is that the number of deaths in our country is far, far higher as compared to what happens in the West. In the West, out of 5 or 6 new cases of breast cancer diagnosed, one woman loses the battle. However, in India, out of 2 new cases that are diagnosed, one woman loses the battle. And that is extremely disturbing, because breast cancer is one of a potential cancer where complete cure is possible if it is detected early and treated appropriately. And unfortunately, just because of lack of awareness, women lose out on this opportunity.
Yes, I was reading again in one of the reports which said that, as you said, there are more number of deaths in India. People come to doctors only when they are in stage 3 or stage 4, especially in India. Even after so much of awareness and, celebrities who have been diagnosed with breast cancer, they coming up and openly talking about it. A lot of campaigns created. Even after all these things, India is still losing. I mean, what can we do about it?
Right. Well, that's a very, very valid point, Sangeeta, and I'm sure Kamal and Anuradha will also agree. There are a lot of myths and fear associated with this disease, not only lack of awareness. Yes, awareness is growing, Sangeeta, but we have a very, very long way to go. And I've seen even in urban women who are educated and who are well read, who are smart women, the achievers, they themselves come to the doctor late very often. And I've seen that a lot of myths and fear associated with this. First of all, talking about breast, even to your family member, is a big, big, big taboo. So breast is not only a sexual organ, isn't it? It is an organ in a body like any other body. And I've seen that women, patients who come to us, the women hesitate to talk about some problem in their private parts even to their own family members. That is one of the reasons why women come to us late. There is fear. There is people feel cancer is death, as if there is no life after cancer. And we have here Anuradha and Kamal, who are live examples of the fact which I'm saying, that breast cancer, if detected early, treated properly, can be cured. It's one of the potentially curable cancers. And just because of lack of awareness, myths and fears, let us not stop ourselves and take good care of our health.
Actually, doctor, I feel the picture about cancer is so gloomy. It's so gloomy. It looks so fatalistic. And many of us, including me, we were so influenced by what we saw among our friends and colleagues
Right.
that we thought, if someone's identified with breast cancer, the end is, you can't come out of it. So why do you want to struggle going through the treatment? And it's here, I think, public perception needs to change by better communication. The gloomy pictures from our movies and articles, all that need to be removed, because that creates a lot of anxiety for us.
Absolutely true. And that is where we need to break the bias against breast cancer. And that is the motto of this year's Women's Day.
Yeah. What is even more concerning these days is it's been detected in young women. Why is it that? Or again, is it because of lack of awareness, or is there any lifestyle issues, or is there anything like diets or the way they live these days?
Right.
Has those things affected young women?
Right, very good question, Sangeeta. Yes, it is on rise in our country in much younger women as compared to the West, and that is certainly a cause of concern. About 48% of breast cancer which occurs in India, it happens in women who are less than 50 years of age. We see a lot of women who are in their 20s or in their 30s who get affected by this disease. In fact, just yesterday we saw a girl who's just 24 years old and she has developed breast cancer. The youngest patient that we have treated is a 17-year-old girl who had breast cancer. Okay, of course, 17 years is one of its kind. It's not common less than 20 years. But certainly it is a cause of concern that much younger women are developing this disease. If you ask me why does it happen, well, I would say that yes, breast cancer is a lifestyle related disease. If you see the life that we live today and the way our parents or their parents lived is so different. Today our life is fast paced and we have so much stress involved. We eat junk food, fast food, we do not eat right. It's so important to eat right, a healthy diet, which has lots of fruits and vegetables in it, which has more antioxidants. It's so important. And the basic function of breast in a woman is to secrete milk and to nourish a young child. Now, if for some reason breastfeeding does not happen, such a woman is at a higher risk of developing this disease. So I would certainly recommend all the women that breastfeed your children. The more you breastfeed, better is the protection for the mother against breast cancer. And that is seen lacking these days. Breastfeeding women are not able to do for whatever reason. They all work and things like that. If the first child occurs after the age of 30 years, again, such a woman is at a higher risk of developing this disease. Obesity is another issue. It is like a disease in our society. Alcohol consumption, smoking is not uncommon anymore in women of our country too. So these are certain of the risk factors which has developed, and an indiscreet use of the hormone tablets, like say long-term use of oral contraceptive pills, or unfortunately in our country, just we can go to a pharmacist and buy a OC pill or an MT pill or a postponement tablet. All these, if you use it indiscreetly, can have long-term implications, and one of that is breast cancer. And also about 5 to 10% of breast cancer runs in the family, and such families tend to develop the disease at a much, much younger age. So, and breast cancer, there is not one cause of breast cancer. It is multifactorial. There are multiple factors which are playing, they are in action to cause this disease. So I would say that, yes, it is a lifestyle related disease. And since our life has become fast paced, since we are aping the Western countries so much, we have also got the disease of the West, which is no more restricted to West. We have welcomed it to us.
Oh God, that's really bad.
Yes.
We have Anuradha with us. I think she could tell us, like, what age were you detected, and how did you feel about it? Since we're talking about age, Anuradha ji, if you could tell us that what age were you detected with breast cancer? You're on mute, I guess. She's on mute.
Anuradha, you're on mute.
Anuradha?
Please unmute yourself. Or maybe I can ask someone who set up this Zoom session. Can you please unmute Anuradha? I think they'll do it. So till Anuradha, is unmuted, doctor, I tell you that we really don't, women never talk of our health.
Hello. Can I?
Yeah.
I was detected at the age of 59, almost on the verge of retirement. I did notice a small lump much earlier, but then I thought it must be mammary gland or something, and I was a little apprehensive of going to the doctor because I had so many commitments. One thing why women put off the visit to the doctor is either they are working or they are at home. They have so many commitments, some wedding in the family, some project to finish outside, and professionally, I had examinations to complete. Second PUC examinations were around the corner. So I thought, let me complete that. I was head of that unit. So I had so many other things to complete. So I thought I'll do this later. By then it had grown. Then when it was unbearable, when it was so big, I went to the doctor. Basically, I just put off my visit by 6 months, which aggravated the problem. So when I went, I was almost on grade 2 and third stage. But doctor, she said, third stage is better than fourth stage, which really motivated me and inspired me. And one thing that was very happy was I was apprehensive of losing my breast. That was one thing that everybody said, you lose your breast. Not that it mattered, but then an organ of mine will be lost. That was one thing that always was a nightmare to me. But when I went to Dr. Jayanti, she said you can still retain your breast and you can get yourself operated. That was a real ray of hope. And even to this day, I thank her, and I also thank the way she has reconstructed the wounded part. And now I'm completely okay. I don't even remember what happened in those days. I don't even remember how the surgery went through. I feel I'm like this always. I don't feel that I had undergone a surgery. It was all the motivation. And another important thing is I had many friends who were also survivors. They had a very positive attitude. They kept on filling me with positive vibes, and that also helped. And I went to an oncologist, but my cousins told me you have to go to a breast oncologist for this. When you're treated by a breast oncologist, you will get better results. And I really am happy that I went to the breast oncologist instead of getting operated from some other oncologist, though they'll be competent. But I went to the breast oncologist and I was operated. And what helped me to recover was I underwent the operation and I followed everything the doctor told me. The diet and what all I had to do, and the date. And on the chemotherapy day also, she would tell me, you have to come here on this date. I never missed out on anything, the diet, the chemotherapy sessions, and then even the radiation session. I never missed out on anything. And after that, everything I followed the tablets that were given, and that helped me. And Dr. Jayanti was so inspiring. When I went into I can still remember the moment I entered the operation theater. She just put the thumbs up, and that told me everything is assured. You'll be fine and you'll be back again bouncing. And every time, and even for my chemo port when I went, I could still feel her giving the thumbs up. That thumbs up of Dr. Jayanti has helped me to recover and survive and smile today.
Right. So such an important thing Anuradha has said, and this is what brings the women to the doctor very late often, like if breast cancer is detected, my breast will be removed is one of the fears.
Yes, one of the fears.
My femininity or my womanhood would be lost, and
Yes.
and losing an organ is quite emotionally challenging, and so I really feel breast cancer is not only a scientific issue, it is also an emotional issue. There are so many factors we have to consider. And well, let me tell all the viewers here that breast cancer does not mean removal of the breast. There are many advanced surgical techniques now available, which are commonly done, which are very safe as well. We can do what is called as breast conservation surgery, oncoplastic surgeries, breast reconstruction surgeries, where not only is the focus on clearing cancer, but also the cosmesis is very, very important, because we do not want to only cure the cancer, but we also want to give a good quality of life to the patient, because like I said, there is so much of advanced treatment available. Most of the patients with breast cancer these days do well. Hence, they have a long life, and we equally have to give importance to the quality of life. And hence, these surgeries is what is recommended, and that is what Anuradha has gone through,
I think my life is much better now than what it was earlier.
Wow.
Yeah.
That's so nice. I mean, so much of positivity,
Yes.
it really
Because I've understood the
helps
value
others.
of life now.
Yes.
I've understood the value of life, and I want to live every moment happily.
Wow.
Once I came out of the theater, that is what I decided. I live every moment. I'll be happy. Let the rest come.
Yeah.
So,
And Sangeeta, I would like to tell you that these women, Kamaldeep or Anuradha, we have a large group of breast cancer survivors called Stree. They're so amazing. And it takes a lot of courage to come up on screen and say that I am a breast cancer survivor. And the only reason why they're doing this, because it will help some other woman, so that they do not go through what these people have gone through. And they are amazing, and kudos to both of you, and thank you so much for your contribution to the other women.
And when I gave a leave letter for surgery, I had written cancer in bold, as I have to undergo a cancer surgery. And my higher authority called me and said, there's so much of hush hush about cancer. You just say you're going for a surgery. Why cancer surgery? I said, why not?
Yes.
Why not? And I boldly told everyone that I'm a cancer survivor. Even to this day, I tell them I'm a cancer survivor, and I'm proud about it, that I've survived. Women fight for existence. Now we also fought for our survivals. Right from our childhood, women fight for their existence, right? And now we fought for our survival. I'm proud of it.
It's
I'm
So
really
definitely
proud.
not
yeah,
less than
so
an achievement.
sometime back, Kamal, I would I would like to bring to everybody's notice that me and Kamal, when Stree was started, we thought, do we call ourselves as cancer survivors? Are these people just surviving? No, they're much more than that. Don't you think so? They have conquered it, isn't it? They are conquered the disease, and that is so inspiring. It's absolutely inspiring.
Yes,
And
the
Dr.
willpower behind it.
And I want
The
to add to
willpower
this.
and the right treatment, right time, right doctor, all this plays a major role.
Adding to what Anuradha said, there are some important points I want to just reiterate for our viewers and listeners, that it's important to go to an oncologist, a breast oncologist, also go to a hospital that can give you a 360-degree, treatment, because it involves a lot of oncologists, from the way the screening is done first, then you go to probably a surgical oncologist, a medical oncologist, a radiation oncologist. So if you go to a hospital that provides you all those services, the outcomes I have seen while discussing with my friends is it's much better to have new trends. And one myth, since we are talking, break the biases, it's very sad that a lot of sexuality is attached to breast cancer because of the organ. So in rural areas, women hesitate to go if there is no lady doctor, and that becomes another factor of delay. So it's always better to talk this. If you can't talk to your family, talk to your friends. Every woman should be informed so that the other one becomes a buddy to them. So these are small little things which mean a lot. But talk it to people, find out who's a good doctor, where can we go, and just detach any of those fears you have and start your treatment early.
Absolutely.
I mean, since Kamalji just took up the issue that, there is a rise both in urban and rural areas of India. Urban areas, again, we ourselves are, so scared to talk about it. Even though we are aware of it, we still hesitate. What about the rural area ladies there? I mean, how can you even stop them or make them understand, or what's happening there? Is it because that they're really shy, or they don't want to talk to others about it, or they don't understand it all?
Right, that's a fantastic question. But I'd like to differ here. Very often, I have seen that the rural women are much smarter than the urban women. Okay, we just because they're rural, our concept of rural need to change. They are aware. Okay, and they are smart. They know how to survive. Okay, they know how to look after themselves. And I've seen that a lot of urban women lack this. Okay, and however, that's unfortunate, and hence I really feel that awareness in a city like Bangalore is as important as it is for rural women. All right, but the incidence, that is the number of cases of breast cancer in the urban setup, is much higher as compared to what we see in the rural setup. In the urban India, it is estimated that 1 in 28 women would develop this disease. Whereas in the rural setup, it is about 1 in 80 women who develop this disease. And that clearly shows that the lifestyle makes all the change. The lifestyle is what is making a lot of difference. So it's the food that we eat, it's everything around us, the water that we drink, the air that we breathe, the stress that we go through, etc., 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 which causes this. But yes, we have to. The rural women are underprivileged, and I'm sure there are a lot of government schemes which have come up for their treatment and to support them. And we are, like I said before, it's a long way to go. We have a long, long way to go, where most of the women will become aware, like what we see in our Western counterparts.
Yeah, right. Actually, I wanted to tell you this. I have a friend in US who is going through the same, and she was telling me that the treatment there is, they get to do a lot of trials. Maybe it's a little more advanced than India, Is that also a reason that, there are less number of deaths there?
No, Sangeeta, I differ in this because we have all the facilities or all the latest treatment available in India. We do clinical trials. We ourselves in our department do a lot of clinical trials and things like that. So I feel the number of deaths in our country are more only and only because of lack of awareness. If you see how it is in the Europe or it is in the US, these are the markets which are driven by either government sponsored health system, or it is the insurance based health system, and either ways a woman in that country gets a reminder either from the government or from the insurance agent that you're due for your mammogram, you're due for your checkup, and they themselves are aware, and the fear or the myths are so much lesser, superstitions are much lesser. That is what stops women in our country from reaching the doctor at the right time. And unfortunately, the valuable life is lost. And very often, when it is so young, their presence in the family or in the society is so important. That's when a woman, succumbs to this disease. It's very unfortunate, and the whole family gets affected. And the ones which are affected most are the children. So I always tell women, like Anuradha said, she was so busy that she didn't have time to come to the doctor, and I've heard this umpteen number of times. Every other day in my OPD, I hear that I was so busy, doctor, I didn't have time to come, So all the women, I would like to tell you that if you love your family, if you care for your family, you need to look after yourself first. If you are healthy, if you are well, you can continue to look after your family for many, many more years, So it's very important. Women's health is extremely important.
True. One woman makes a whole difference in the house.
Absolutely.
I have read on the WHO site that those nations who have done well with creating a lot of awareness among women in the community have got women early to the doctors, at an early stage. So doctor, tell us the symptoms, the moment someone sees something, when should they reach the doctor?
Yeah, there are very few things that you need to remember. One needs to remember. So it can start as a lump, a lump either in the breast or in the underarm region. Now, what do I mean by lump? A lump, you can say a swelling or a mass or a protuberance either in the breast or in the underarm region. All right. Now, the point here to remember is that very, very often this lump is painless to begin with. Because there is no pain, the woman feel all is well. I see a lot of women, I noticed a lump, but I had no pain, so I didn't come. So just because there is no pain, do not think everything is okay. If you find a lump either in the breast or in the underarm region, go to a doctor, get yourself examined and properly investigated. That's point number one. Now, the second thing is there could be some skin changes. The skin over the breast or skin in the underarm region are normally smooth, but sometimes it can change. It may become reddish, or there may be rashes, or it may seem as if it is pulled inside. There is kind of a dimple in the skin. If you notice any of this, yes, it could be sign of early cancer. Your antennas need to go up, Or if there could be, third thing is that if there are any nipple changes, normally the nipples of the breast are pointing outwards, but sometimes it can become crooked. It can become, it can go inside, what we call as inverted nipple, If that also could be one of the signs of breast cancer. Or there could be a sore on the nipple, that is a wound or a sore which does not heal, or there is a discharge coming out of the nipple, some kind of fluid flows out of the nipple. If you find any of these, please do not panic, okay? It does not necessarily mean that it is breast cancer, all right? If you find a lump in the breast, if you find skin changes, if you find nipple changes, Do not panic, because 80% of the times it is not cancerous, all right? But 20% of the times it could be cancerous, isn't it? And that's what you don't want to miss out. Hence, if you find any of these symptoms, without wasting time, go to the doctor immediately. Let the doctor ask you for the appropriate investigations and get it cleared by the doctor as to what kind of a lump or a problem that you're facing with, and get yourself treated. We don't want to miss out that 20%. Hence, if any of these symptoms are found, it means that you need to go to a doctor and seek medical help.
Okay. So we have Anuradha ji also. Anuradha ji, can you tell us what were the symptoms and how did you detect it? Anuradha ji, are you there? She's on mute again.
She's on mute.
Yeah.
Now, yes, now?
Yeah.
I had a small lump under the breast, which I felt about a year ago, prior to the surgery. I thought it must be a mammary gland enlargement. And I was a little shy to talk about it to anybody else because I'm a single parent. I had lost my husband. So I could talk to my mother, but I didn't want to panic them. So I just thought it was a mammary gland enlargement. Since there was no pain, I just kept quiet. After some time, a friend of mine called me to go with her for mammography. Even then, I was very busy. I said, you finished off, I'll go as next step. Then when it started enlarging, I'd been to Goa, and when I was playing in the water, I could feel a little pain. It was then I told my daughter-in-law this pain, and she took me to the doctor immediately. It was she who told me, you have to consult a doctor immediately. So I went there. Within a week, everything was decided and surgery was performed.
Right.
And here I would also tell, everybody would tell me that surgery is very painful, post-surgery is very painful, but absolutely without any pain, the surgery was done. And afterwards also, I did not feel any pain. I don't know why it is. I did not feel even an iota of pain post-surgery.
Right.
It's not about the physical pain, but I would definitely want to know what happened to you when you were diagnosed. What was your state? So that, other people who go through it also know
when I was
how to
diagnosed,
face it.
I did feel scared. I was a little panicky. But then I had friends who had undergone this. And all of them were leading a very happy life. And they were more than what I could ever think of. So they were the ones I immediately spoke to them. They said, come on, you're joined our tribe. No problem. You'll be like us one of these days. They said, nothing will happen. You'll just survive this. Only thing is, you should have willpower and confidence. And they told me to go to the right doctor and a breast oncologist. They said, don't go to any oncologist, go to a breast oncologist. And a friend of mine, she has survived for 25 years, another friend for 12 years, another friend for 8 years. And my aunts also had cancer genetically, but they did not have breast cancer. Other parts, they did not live long. But breast cancer patients survived a lot. So I felt I will also survive that. And I had that confidence that I would survive. And then I went to Dr. Jayanti, and she said, no, 4 is better, 3 is better than 4. That one word. That one. And another thing she told me, when my son asked her if it was fatal, she said, never talk about fatal. Never talk about not surviving. She said, everything is fatal. You just cross, who knows, when you cross the road, somebody may hit you. So never talk about death through cancer. Right, doctor? You just told me this. Anybody will die.
I think having a doctor like her is also very important.
She said, why do you say
actually makes you so positive and so cozy
100%, 100%. She told me, why do you say it is fatal? Now you may cross the road, somebody may hit you. And then corona, everyone is dying. So that without any, signal, people are going. At least you have got something, you have a cure. But corona, they just vanished like that. So don't you think you're better? You're diagnosed, you got treatment. And she said, never talk about the word fatal. That is one thing that I really was impressed.
I think connecting to what Anuradha says, the survival rates of breast cancer. that can really infuse hope and confidence in women.
Yes.
So I would like you to throw light on what's the survival rate for breast
Yeah.
cancer.
So, yeah, it's just, all the stages put together, like Anuradha said, stage 3 is better than 4, stage 2 is better than 3, and stage 1 is even better, so, so when all the stages put together, if a person is treated properly, the survival rate is almost 85%, which is fantastic. And all the credit goes to the immense research that has happened, the advanced surgical techniques, the wonderful drugs which are now available, and the radiation techniques. There are now hormone tablets available, there is immunotherapy, targeted therapy. There's so many advanced treatment options these days that most of the women survive, and the earlier one goes to the doctor, or the earlier the stages when the treatment is started, better are the outcomes. All right. But so overall survival is 85%, which is fantastic. Don't you think so?
True.
And
Yeah,
my, and my
that's
friends
the
never
brighter
told
side
me
of
about
it.
the treatment. They only told me you consult a doctor. I think the cancer differs from one person to another. But I may have a breast cancer, another person with the same symptoms may come to me. I should not talk to her about the treatment, what will happen. I should only guide her to the best oncologist. Is this correct, right, doctor?
That's true. Even breast cancer, there are many, many varieties. There are hundreds of varieties. There is no one size that fits all. There's no one treatment which can be given to all the breast cancer
Right.
patients. Before we plan the treatment, there are many things that we take into consideration. So yeah, today is an era of precise medicine. Personalized treatment. We can do certain genomic tests now, wherein we can know exactly how this cancer in this body is going to behave. And that is possible now. So well, things are looking very, very good. One need not lose hope. Just the word cancer is not end of the life. There is so much more one can do. It's just as any other disease.
I think that's so
Doctor,
true. That is what matters a lot. It's all
Right.
in your willpower and optimism.
Yes.
How you look
Yes.
at life.
Absolutely. Absolutely.
Doctor, I had a person in my acquaintance. She was actually pregnant when she was diagnosed with breast cancer. And she's so successfully, gone through the whole thing.
Yes.
So, you can also tell us something about that, because and if it's younger people are getting also,
Yes.
does it affect their family life, their fertility or anything?
Right. Yes. Yes. So a lot of younger people get affected. The issues are also different. Like you rightly said, many of them are not even married, or they've not even started their family. So now there are treatment opportunities where not only cancer is cleared, but also it is ensured that they can have a normal life post cancer treatment, meaning having a child or breastfeeding. It is all possible these days. There are fertility preservation techniques where the oocytes, the eggs of the woman or the embryo can actually be preserved, and it can be used later on when the woman wishes to have a baby, So all these options are now available. It's available in our country. We routinely do it in our department. And at any age one need not fear this disease, and you can have a normal life. You can have a normal life after it, whatever age you are in.
That's nice. That's nice. So positive. Whenever we get to interact with Dr. Jayanti, that is what we learn, to live life in a very positive way. I have a very personal question to you. Every time you see your patients recover from breast cancer, what do you feel as a doctor, as a human? What do you feel?
Yeah. Um, well, that is what is our job. It is very, very fulfilling, of course. And as a doctor, nothing can be more fulfilling to a doctor than seeing the smiling faces of their patients and their family members, And as it is fulfilling to see a success story, when a patient comes to us late, it equally pains us, that she has lost out on an opportunity of complete cure just by coming late. We should not try our luck too much. There are things, many things are in our control, and we need to take care. There are simple things that we need to do, which we will talk in the subsequent talk shows in this month, where we will teach how you can actually detect the disease early. What do you have to do? What are the simple things that need to be done? Yes, it is fulfilling. We have mixed emotions as doctors. Because we have success stories, we have not so many success stories. Sometimes we feel our knowledge is so limited, that we couldn't do much more to this particular woman as we would have liked to. Yeah, there are all kinds of stories.
That's so humble of you. That's nice.
Right.
So I think we're ending it with a very positive note, Everybody who's watching it or who will be watching it will always remember that, whatever comes to you, you have to take it in a very positive way and go to the right specialist, as Anuradha ji said. So early detection is something that would help.
Absolutely. It is a game changer.
Yeah. I think, as Dr. Jayanti mentioned, that we'll be meeting every Saturday at the same time, that's 4 p.m. And there'll be a continued conversation on this topic. Today we just dealt, and one of the important messages is the biggest risk any woman, can have is to believe she is not at risk of breast cancer, because it can happen after puberty at any age. The older we get, the chances and the risk also increases, premenopausal, postmenopausal. So, Dr. Jayanti, I want to say that break the bias is the theme. Can we actually be in that pose for a shot, for a small, photograph, Sangeeta and Anuradha, and all those viewers, whether you're watching us on Facebook or you have joined the Zoom session, show the confidence in this pose that we are breaking all biases, and we believe breast cancer, when diagnosed early, is treatable, curable, and we can lead a quality life. Let's join the medical community in breaking biases and stigmas that are existing in society. And a healthy woman is smart economics. And I would like to conclude with a beautiful quote of Joyce Mayer, who says, I believe that the greatest gift you can give your family and the world is a healthy you. So it's never too late to change, make changes in our lifestyles. As doctor mentioned, just remember all that, be active, eat well, spend some time on exercising, avoid maybe hormonal pills, say no to smoking, alcohol, be alert if there is a case of cancer in the family for periodic risk assessment, reach the doctor early. So this session was basically tell you that women should be vigilant. If you're careful about your weight, your BP, your sugar levels, please add that you should be also careful about your breasts. See them, know them, changes to be noticed, to be brought to the attention of doctor. 80% cases can be non-cancerous, but why take a risk? So with this, I should thank Sangeeta. Thank you so much. The energy you bring in your performances, you brought in our discussion today. Thank you.
It was a pleasure. It's really a pleasure to talk to all of you guys, especially, when I see Anuradha ji or you talking with so much of energy and so much of positivity, it really makes me also, very optimistic. Thank you.
Absolutely.
Thank you. And thank you, Anuradha, for joining us and, bringing in all your personal experiences and sharing it. I must say we should be in the company of positive women like you had a positive group. And of course, the Apollo team. I think you've done an amazing job of planning series, which means you dedicated to the health of every woman so that there's no fear, there's no anxiety, and that's absolutely so encouraging for all of us. And thank you, doctor.
Thank you
Thank you,
so
Dr.
much.
Jayanti. It's
Thank
always
you,
a
Kamal.
pleasure, touch base with you and to see how you are going each day from strength to strength and creating awareness. So you'll put India on the map, of creating awareness among women. Thank you so much. Thank you, everyone.
You're a
And see
big
you all again
inspiration.
next Saturday. See you all again next Saturday.
Yes, see you next Saturday at 4 p.m. Thank you.
Bye. Thank you. Thank you.
Bye.